Hello, everybody, and welcome. Thank you for joining our webinar today. My name is Vaidyanathan, and I'm the chair of the Sociology Department at the Catholic University of America. It's my privilege to host this conversation on policing and mental health in this time of crisis. I want to spare you the perfunctory remarks on how the unprecedented nature of this crisis is affecting us. I mean, you're all experiencing it. You're all reading more news and reports about it every day than you'd care to, I'm sure. But we're here today to talk about how this crisis is affecting policing in particular. Police officers are among the professions on the front lines of this crisis. So how is this strange situation shaping officers and departments and the relationship between the police and the public? And in particular, what are the impacts of this crisis on the mental health of officers as well as the people to whom they respond? What does all this mean for the future of policing? We're honored to have with us two remarkable leaders to help us think through these questions. I'm just going to introduce them very, very briefly so we don't cut into their time. Kevin Davis served as the 39th Commissioner of the Baltimore Police Department from 2015 to 2018. He's a graduate of the FBI National Academy and FBI National Academy Institute. Commissioner Davis is now the Chief Security Officer for Armored Things in Boston. Then Joe Smarro is a decorated combat veteran from the U.S. Marine Corps. And after serving 2 tours, he joined the San Antonio Police Department, where he helped start and grow the mental health unit. He's a TEDx speaker and the main subject in an award-winning HBO documentary. He's also the founder and CEO of SolutionPoint Plus. So each of our guests will speak for about 15 to 20 minutes, and then we'll have plenty of time for Q&A. If you'd like to ask a question, please use the chat button. We'll try to get to as many questions as we can today. So without further ado, I'm going to turn it over to Commissioner Davis.
Well, thank you, Brandon. It's an honor to be with you, and it's good to see you, Joe. It's an honor to be with you as well. And hello to everyone participating in this webinar, and thanks for taking time out of your day, midday, to be part of this important conversation. And I intend to limit my remarks because the most fruitful part of any conversation is hearing your questions and concerns and hopefully responding to them in a thoughtful way, so we all emerge knowing more things than we did than when we came on together. So police officers, this profession, we have 18,000 police departments in the United States, just shy of 1 million municipal police officers in our country. And police officers now, we handle crime, we handle disorder, we handle threats to a certain degree, we handle threats to our homeland security. We're not used to handling a pandemic, and just like any other profession and just like any other person, any other human, we're building this airplane in midair just like everyone else is. We're not unique. We're not exempt from the concerns, the worries, and the fears that everyone else experiences. Police officers in particular, we don't have the luxury to work from home. Police officers deal with people and neighborhoods and communities that are in crisis. You can't dial it in. That face-to-face contact is always necessary. So one of the challenges police departments are facing is, how do we continue to serve and interact with communities and people who need us in a way that both protects them, protects police officers, and continues to fulfill the mission of American policing. And it's very, very challenging. I would say, from my experience, and I led Baltimore from 2015 through 2018, and we did a survey at one point, and the average age of a patrol officer, the police officers you see in marked patrol cars wearing uniforms, they respond to 911 calls for service, the average age was about 26 years old. And a lot of these patrol officers are newly married, many have small children, some even have aging parents who they live with and take care of. So police officers, again, like anyone else, they're concerned about being exposed and taking that home to their families. But they're also simultaneously tasked with interacting with people. So who do police officers interact with? They interact with crime victims. They interact with perpetrators of crimes. They interact with people who report crimes. They interact with people who witness crimes. Always interact with confidential informants. So there's a wide variety of person-to-person contact that police officers have. And the leaders of our profession are being tasked with not only maintaining a level of service to the communities, but recognizing that their police officers have their own fears and anxieties and apprehensions. So how do you protect them? You know, one of the most unique endeavors that I've seen is right here in the Washington, D.C. area with the Hyattsville Police Department. It's a municipal police department of about 45 sworn police officers. They have a police equipment decontamination station that every police officer takes his or her police car through at the end of their tour duty. They take their uniforms in as well. They launder their uniforms on a daily basis. They wipe down and disinfect all the equipment that they wear, to include their shoes and their gun belts. That certainly gives peace of mind to police officers, and it recognizes the important work that they do. One of the unexpected challenges, in New York is our nation's largest police department of about 38,000 sworn police officers. And just to put that into some perspective, NYPD is the largest in the country at about 38,000 cops. The second largest is Chicago at about 12,500. So just give you an idea how big and vast the NYPD is. So they were down about 20% of their sworn workforce about a week ago, 7,000 police officers. So what do you do with that as a police leader? You just can't go pick a police officer off of a tree. And you certainly can't train anyone fast enough to be productive. So a lot of police chiefs around the country, particularly in Maryland where I am, they're looking to bring back still certified retired police officers or police officers who otherwise resigned in good standing. That police certification is typically good for 3 years. It's a combination of, you know, incentivizing those retired police officers to come back for a limited amount of time, like say up to a year, to have them serve to fill in the gaps. So many police departments, most police departments actually could not afford a hit of losing 20% of their workforce. In fact, half of our nation's 18,000 police departments have 50 police officers or fewer. So that type of hit is something that most cannot sustain. And again, there's a lot of things going on. Police officers are in the same boat as everyone else. You know, we chose this profession, and to many of us, it's beyond a profession. It's a borderline vocation, because we do embrace the nobility of protecting and serving and putting our own lives at risk for the sake of others. And I think if you're a police officer and you don't embrace those necessities of the job, then you're not living up to the oath that you swore. So how do we do that safely? How do we protect ourselves? How do we protect the community and our families? There's a lot to talk about. I'll be quiet and turn it over to Joe now, but I'm looking forward to your questions as we move through this webinar. Thank you.
Yeah, thank you, Commissioner Davis and Brandon. I appreciate the introduction and the opportunity to do this. And I agree with everything that Commissioner Davis just outlined. And also that I would love to interact with or dialogue as much as possible. And so we were fortunate to have some questions sent to us before we went live. And so we can get on those if needed. But if anyone has anything, please put it in the chat box. I heard something recently that really resonated with me, and it said, in our shared circumstances, our differences go away. And I think, you know, there's very few things in the history of our world that we can all relate to from a global scale. This is one of those things where, you know, it really is boundaryless. There are no, you know, when we talk about how this is affecting people, it really doesn't matter what you have, what you don't have, what you look like, who you are. It really does not matter. When we're talking about the global pandemic, everybody is being affected on some scale. Now, to that end, it certainly is a spectrum, right? Because we are fully aware that, you know, more than 10 million people are out of work. That one of the beautiful, you know, fortunate parts of, you know, our profession in law enforcement is that, you know, we're mandated to still go to work. And that's, you know, catch-22. It's like, while some of us would love to be home and we're kind of, you know, afraid or uncertain about what the day-to-day is going to be because it's so fluid. You know, I'll tell you here, it's like for a good 3 weeks straight, every day we show up to work, something different something new, some new rule, some new procedure, some new way to operate. And so that's taxing, not knowing what it's bad enough that every call is different for a police officer. Now it's like the rules in which we're going to operate are changing. Wear a mask, wear this, don't do this, don't do these calls. We're going to do this way now. And so having to really maintain that level of just acceptance and embracing everything that is coming at us is part of it. But I think another thing too is that we really have to accept and embrace this idea that first responders go beyond police, fire, EMS, because the nurses and doctors are getting hit so hard right now. And there's a lot of stories that are being covered about them and how they're being affected and impacted. And so I think that's super important too, that we kind of expand our definition of first responder. But when we talk specifically, so I've served on a mental health unit now for over a decade. Full time, that's what I do. I'm fortunate to be on a large police department. We have been very lucky here. I'll say that because I think the last count I heard, which was last week, was we had 7, and we have about 2,300 sworn officers. And so to have under 10 officers impacted by this is pretty impressive. I think we're fortunate to, while we're in a very populated city and county of almost 2 million people, and we have a large department, we're still very spread out. I think that the department is very smart on how they've responded to this right away. We're expediting calls as much as possible, which means that we're not responding when it's not necessary. If we can handle a call or a report over the phone, that's what we're going to do. And so I think that, a lot of good things have come from this as far as responding, having good leadership, really stay ahead of this, working closely with public health and getting the most relevant recent information and disseminating as quick as possible. Because I think that's one of the things that is super important during a time like this, is that communication channels stay open, because there is so much uncertainty, right? People are consuming information from various sources, and we won't get political here, but just, people are getting information constantly from different platforms, and, it's spread this social contagion of fear right away, and you can compare this to the whole toilet paper epidemic. That was a social contagion spread on fear. Someone started that somewhere and said, oh my goodness, we have to buy all the toilet paper. And now it's still hard to find to this day, more than a month or 2 months later. And the reason that happens is because of human beings and the behaviors of humans, and how we have this like negativity bias that's natural within us. And we tend to attract or seek fear-based information. And so I just would say, please, be mindful of anything that we're talking about. Challenge any beliefs that you have of what they are and why you have them, because maybe that's not the whole truth. And maybe it's not necessary to do every single thing that we're doing personally, because how much is that impacting the global scale of this? I think it's important to be responsible for sure, whether you're in first responder role or not. It's absolutely imperative that we are socially responsible, and we're doing everything that the CDC recommends, and wearing masks when we're out in public, and I don't even like social distancing. I think physical distancing is really what it should be. I think we have to be careful about the terminology we use, because social distancing has really led to increased isolation. And I think it should be physical distancing with an emphasis on social connection. And we're very fortunate that we have technology like this, like this Zoom call. And again, many thanks to Dr. V for putting this together, because right now, we're connecting with, I think 50 or more people that are on this live webinar. And we're able to do this through technology. And this is a form of connection. And I think it's super important that we leverage these. And so that's a lot of what I've been doing for the last year. My entire existence within the police department is about the self-care and wellness of officers, which is super important right now. It's been important for a very long time, but I think it's great that, the old saying of never waste a good crisis. And that's not to be insensitive, but we can't help the fact that what's happening is happening. So how can we leverage this to improve things? How can we leverage this to improve systems or processes that are in place right now? And I think addressing the self-care and wellness of our first responders, our officers, our fire and EMS men and women that are out there on the front lines. Again, having to expose themselves daily, and then a lot of departments don't have those decontamination stations that the commissioner mentioned. A lot of them don't have that, so it's kind of on their own of how much am I going to decontaminate before I go home. And families are concerned. My wife is concerned when I'm working. Did you make any calls today? Did you have to go into anyone's home? Like, make sure you're handling yourself before you get home, because we don't want to bring it into the house. And so the ripple effect of this has been pretty magnificent, and the scale really does go beyond just the ones working on the front lines. I know that there was a lot of questions about domestic violence and mental health and all those, and so I would love that we kind of just dialogue and get into those, maybe moderated by Dr. V here. But again, I'm grateful for this opportunity. I think that these are unprecedented times. It's not a sad reality, it's just the reality. And I really believe that the landscape of many things, business, school, jobs, will never be the same. I really think that this is going to completely change the landscape of how so much of the way we operate in this country and in the world is going to be affected. I really think that, people are realizing that we can be almost as effective working from home in a lot of professions, that they're doing just as much work and or accomplishing the same goals and mission from working from home. Law enforcement doesn't have that luxury. Doctors and nurses don't have that luxury. Fire and EMS don't have that luxury, but a lot of business does. And so I think that we have to be open to accepting the fact that this is really going to change the way in which we operate and do things. And so that can be good and bad, depending on how you choose to see it. But anyway, I'm going to stop blabbing, and hopefully we can get into the specifics now and address certain questions, because I'm looking forward to answering some of those.
Great, thank you. Thank you, Joe. Thank you, Kevin, as well. Yeah, please feel free to send in your questions, I think either through the chat or there's also a Q&A button, either of those. So we do have a few questions that have come in initially, and one of them, maybe you'd alluded to, you talked about domestic violence, that there's reports on, that in the papers and so on, with families being locked down. Do you find an increase in such calls? Do you find, how are officers responding to that? What are you hearing? What are you seeing there with respect to that?
Yeah, so it's interesting. And I'm fascinated by data and where it comes from and how they gathered it and what it actually is saying. Because I think a lot of the times, it can be controlled to meet a certain need or request. But I think, we had it was early, it was preliminary, but the media jumped on it, was like, hey, why do we have a 19% increase in domestic violence here in San Antonio? Is this COVID related? And I was just reading this morning from the Mitchell Project, and they were showing in like Austin and 2 other cities, but how there's been a decline, and that they're actually showing that it goes down. But here's 2 things to consider when you're talking about data like this. A lot of police departments don't report their data for a year after what's happening right now will be affected in next year's data based on what's being captured right now. Not everyone does real time. Now, there are like the UCR and the FBI collect certain things. But what I found fascinating was, while there is a decline in certain cities in domestic violence, what they actually attributed that to is the fact that the people who would normally call these DV hotlines don't have the space or the freedom to actually reach out and make these calls. And so a lot of the calls that are coming in are calls from neighbors or coworkers that during a Zoom call or a meeting, they're making an outcry saying, hey, can you make this call for me? The other thing is what I've read is that while the statistics show that there might be a decline in domestic violence cases, the actual violence of the DV cases coming in has gone up. Whether it's murders, strangulations, or the type of assault has become more aggressive. And again, consider use this time for self-reflection. If you're working from home or having to do a lot of things from home, nobody is used to having this amount of time with their significant other, with their kids, with their having to be a homeschool teacher, and always having to be present and available and on for your family is incredibly strenuous. And so I think that stress levels have gone up, anxiety's gone up. There has been an increase in mental health calls. I know we had a 30% increase just in March in San Antonio from last year. But again, the ask was, is that strictly related to COVID? What we looked at is previous year over year, we've had a pretty significant increase just year over year. And so while absolutely there could be, it could be a contributing factor, it's hard to say that that's the only factor.
That's really great. Commissioner Days, I've got a couple of questions for you here as well. One of them is how do you think this crisis is posing new challenges for the future of policing and the future of relationships between civilians and the police? Would it change the trust that is established, or the lack of trust between civilians and the police?
Sure. Well, Dr. V, that's a great question. I saw that earlier. So whoever asked that question, if you're on, great question. The police disproportionately, no matter where you are, whether it's big city, suburbs, or rural communities, interact with vulnerable communities and vulnerable people. So it's no surprise, at least to me and my experiences, that the neighborhoods and communities that struggle with drug addiction, that struggle with unemployment or a lack of job skills, that struggle with high school dropout rates that are above the norm, struggle with transportation, struggle with healthcare, those communities, no matter where you are in America, have a disproportionate number of interactions with police departments. And that also bodes for crime statistics as well. So I don't think fundamentally that the mission of police departments is going to change when the initial COVID-19 dust begins to settle. We're never going to be able to quote unquote dial it in. We can certainly do better things internally or with community groups by using technology more often. But when someone dials 911 and someone's in crisis, someone's in trouble, someone's a victim of a crime, there's always going to be a necessity for a police officer to personally respond and be physically present to make the best decision to mitigate the harm that is taking place. So one of the concerns I have while we're in this COVID moment is that those vulnerable communities will see police officers less often. And by virtue of this pandemic, that's going to be a given to a certain degree. I imagine that the amount of foot patrols is down everywhere. I imagine that the amount of non-criminal related police citizen interactions is down because, and I'm going to steal that, Joe, physical distancing versus social distancing. We're just interacting face to face less often. So of the concerns that I have during and post COVID-19 crisis, we have to be careful that the most vulnerable communities don't see their police departments and their police officers as retreating from them. They need to see us. They need to be able to interact with us. It's different now, no doubt about it, but we really have to be careful that we're interacting thoughtfully, but interacting nonetheless with vulnerable communities. We can't pull up our tent stakes and retreat. We don't have that luxury.
Right, thank you. Speaking of vulnerable communities, I have a question here for Joe from Mark Carmona in San Antonio. How's it going with SAPD mental health unit and the homeless? What are you learning? What is the new normal? Yeah, and then maybe even Kevin, if you have any thoughts on that from Maryland or DC.
Yeah. Hey, Mark, thanks for the question. And, I'm hoping that what is the current normal is not going to be the new normal when it comes to the homeless, because and again, I don't want to overstep my boundaries here, because I get that there are decisions made at different levels of people and in closed door meetings or Zoom meetings or whatever. So I don't know all the things, but what I do know is that we are pretty well known for our Haven for Hope transitional shelter here in San Antonio. It's one of only of its kind in the nation, and it's an incredible facility that does a lot of work within the community. But when last I heard was they were no longer taking people, they were no longer accepting new members, they were no longer open to the homeless people that were needing it the most. And I also have spoken with some of the social workers and community partners that work with the homeless that will go out and, proactively engage them, trying to provide them assistance. And they're frustrated because they've lost places to actually go. And again, if you think about what the Prospect Courtyard looks like, which for those of you that don't know, it's just an open, area, outdoor living. They're provided a cot, a place to sleep. They have full-time armed security, life safety officers there. And, they're trained in mental health. There's a lot of good things in place, but because it is, I don't know, they have almost 1,000 people in there each day, and there's no way they can effectively social distance more than several hundred. And so I don't know what their latest numbers are, but I know the fact that no one can get in there right now. I am seeing more camps pop up. I am seeing people under bridges more than I had just a couple months ago. And so people are losing places to turn to, and I'm hoping that that'll be temporary. Once, whatever needs to happen. I don't know what the catalyst moment needs to happen. I'm hearing, again, I don't want to be part of the social contagion, but we're a ways away from having a vaccine. And so if that's what it's going to take to actually get programs and things back up and running, that's going to be a long time. I don't know what type of impact that's going to have on communities, because we do have a large homeless population here. Just because we are in the South, the weather's great. And so between us and Austin, which is only an hour drive, we have quite the number of homeless people that are being affected by this. And it's difficult. It's difficult to reach them. It's difficult to engage them and provide them the resources that they need.
Dr. V, I'll just add to Joe's comments, and it goes back to my previous answer about vulnerable members of society. If you're mentally ill, if you're developmentally disabled, if you're emotionally disturbed, if you're homeless, if you're profoundly drug addicted and you're on our streets, not only are you interacting less often with police officers, but you're interacting less often with the local health department, less often with a faith-based outreach program. All those things have been drawn back. So again, we have to be careful to not give the appearance or the reality of abandoning the most vulnerable amongst us, because when it comes to I know this is part of another question, perhaps, incidents of crime. I know, as a matter of fact, that hurt people hurt people. So when it comes to personal interactions that vulnerable people have with each other and with others, we're going to see potentially a rise in those disturbances if we don't keep our finger on the pulse of what's happening to the most vulnerable amongst us.
Great, thank you. Commissioner Davis, I have another question. Perhaps you could start with this as well. This is from Saud Al-Hindi. How are authorities dealing with this dilemma of releasing inmates to counter the spread of COVID-19 while at the same time ensuring there's no surge of crime?
Well, that's interesting. The governor of Maryland, Larry Hogan, he's a Republican governor in a very, very blue state. I think Massachusetts has the same situation, but Larry Hogan, back in 2016, Maryland's governor stood up a justice reinvestment committee, and I had the pleasure of being part of that. And from that, Maryland's incarcerated population has been reduced by 25%, largest reduction in the country over the last several years. So from that, you would hope that the folks who are violent, folks that hurt other people, your violent recidivists, your violent repeat offenders, those are the folks who are incarcerated. And if in fact, and I don't think you'll find many police chiefs or police officers who will disagree with this, if there are folks who, by virtue of their age or by virtue of their physical condition and their health, are better served outside of incarceration, whether it's a halfway home or back into society. I think everyone's okay with that. It just has to be done thoughtfully. It can't be a knee-jerk reaction. The close quarters that exist in our jails and our prisons, by virtue of the fact that folks are incarcerated, that type of proximity is dangerous when it comes to the coronavirus. There's no doubt about it. But we just have to move forward thoughtfully. But I think a lot of that work to ensure that only people who need to be incarcerated are incarcerated is being done now better than it ever has been. We're certainly not at a perfect place yet, but there's a lot of thought leadership out there amongst governors and mayors and quite frankly, police chiefs that in that conversation didn't exist in the past. So it's underway, it's necessary, but it has to be done thoughtfully.
Well, there's a related question from Denise Nazaire, which is how can police departments address officers' concerns for their safety and wellness during encounters with the public during this pandemic? And perhaps, Joe, you could talk about a little bit of what's happening in San Antonio there.
Yeah. And, and just real quick to piggyback on what Commissioner just finished with, I think too, we have to understand beyond just releasing people from jail. There's one of the other concerns is that, at least here locally, what's happening because the courts are essentially mostly closed down. We were just we have a pretty progressive threat assessment team here in San Antonio that collaborates with the FBI and Secret Service. And we have weekly meetings and monthly meetings. And anytime there's a real threat to the public safety or the operations of a specific place or a business, there's great concern. But one of the issues is that, if we have someone on probation and part of their terms are drug testing or whatever, they're just not doing those right now because they can't. And so it's hard to effectively manage and mitigate risks or threats to the community while we're operating the way we're operating right now. Transitioning to the actual wellness of the officer. So two different things here, right? Because we have the safety of the officers and then the wellness of the officers. And while they might be related, they are different. The safety is, it's, things not just physical safety, but also like emotional safety and psychological safety. I love, again, what Commissioner was talking about earlier with one of those departments on the East Coast, that what they're doing. I think it's great, because I think one of the challenges is that because this has never really happened before in our country, in our world, people are just trying to do the best they can with what they have. And for some, that's great because they are forward thinking. For others, it's just not enough. And who decides that? I don't know. But I will say that, one of the unfortunate things is that, for our department, we have in-service training, 40 hours every year. Every Tuesday, I was out there teaching to 55, 60 officers every week. And one of the classes I taught was a self-care and wellness class. And from that one class, I had so much positive engagement and feedback from the officers. One week, I had 3 of them come up to me after and say they wanted to get into therapy services right then and there. Several of them came up and told me they were struggling with different types of addiction: alcohol, porn, pills. And so I've lost that opportunity now to engage, because while we've had a very, very great and well-received mental health unit, what we know, especially about the type A of cops, is that they're not going to voluntarily, most times, they're not going to voluntarily stand up and ask for help. Almost the perfect thing has to happen, which is they have to be willing to do it in the moment, and they have to have easy access, which means when I show up, and I'm teaching a class that's really kind of breaking them open, getting them to see things from a different perspective, really hitting them at their emotional core. And then I'm just there. They're going to walk up to me and say, "Hey, all right, I need this. It was really speaking to me." It's kind of like being at church, whatever you believe in, but when you're sitting in church and the pastor's talking, you're like, "Oh, is he talking to me?" And there's 2,000 people there. Probably not. He's talking to everyone, but something in you was receiving that message. Officers are struggling right now more than they ever have. And what I've said for the last 2 years is that if we can solve the mystery between this, the chasm between, right now we have more services available for first responders than we've ever had in the history of our profession. yet our suicide numbers are higher than they've ever been in the history of our profession. How do those two things coexist? You know, it's like as access to resources increases, the number of suicide increases. And all I can think of, it's a cultural issue. And we're just not doing a good enough job collectively of redefining the way we train and prepare our young police officers to really deal with what the realities of this job are. And I've said this for a long time. If you look at a lot of police departments recruiting videos, so much of the recruiting videos is focused on the minutia, you know, the helicopters, the dogs, the SWAT teams, the high speed stuff that just is not the 95%. It's just not. 95% of police work in this country is community engagement, community service. And I think, to the commissioner's point earlier, this is what is very, very troubling right now, is that most of what we do is engage in with the communities, with businesses, with schools, with you know, people that are out working in the community. Now that most of that has been shut down, the only thing really open is hospitals and grocery stores, you know, essential businesses, some, you know, car maintenance, things like that. But a lot of business has been shut down. And so law enforcement's kind of like in this weird space right now of like, what are we supposed to do? And for us, it's truly, it's as little as possible. There's no proactive policing happening, because why have an engagement or an encounter with someone if we don't have to right now? We're trying to ride this thing out. So I think better equipment, PPE equipment is super important, making sure everyone has everything they need. But also I think that we need to find a way to get creative to address wellness, to meet officers where they are right now, which is on shift and then at home, on shift and at home. And if we only have that limited ability, because we're not doing trainings, we don't have the access that we used to have, we have to be creative in how we're going to continue to get them to speak up. Because I'll tell you, since this has happened, since we've gone into this quarantine mode and this weird thing, I have not had one officer reach out for help. And before it, just from this year already, I think I was up to 9 or 10. And so it just stopped. And it's because their focuses and priorities are elsewhere now. And so I'm concerned about that.
Thank you. I have a question here, a couple of questions from Dan Cornfield. One of them is, while attempting to move your cities forward in how police engage with mental health issues, what failures in both model concept and in implementation did you experience along the way? And what lessons can other cities learn from these failures?
I'll be glad to give that a shot, Dr. B. First things first, our profession is doing better than ever when it comes to, like Joe said, the internal health and wellness of his police officers, but we're also doing better than ever, not perfectly, but better than ever in responding to people in crisis. It's relatively new to our profession. When I became a police officer, there was no block of instruction on crisis response for the mentally ill, developmentally disabled, and emotionally disturbed. Now there is that type of training, and it's, I think the norm is all police officers receive a baseline of training when it comes to crisis intervention. What I did in Baltimore as a police commissioner, and what I did in Anne Arundel County, Maryland, when I was a police chief there, is I created a specialty unit that was a blended group of very highly trained police officers and mental health professionals. So I think the model, at least in my personal experience, is everybody needs the training. There's no doubt about it. It's not a luxury. It's a necessity to have crisis response training. But I found it most helpful to have a group of highly trained, motivated police officers with an aptitude for that type of interaction, blended with mental health professionals. In Baltimore and in Anne Arundel County, they ride in police cars together. So when they hear that call for service on the radio, they respond with the dispatched patrol officers to start handling it right away. So I think, at least for my comfort level, that's a model that I found to be effective. 10 years from now, when you talk about mobile crisis response, it'll probably be even better. But right now, where we are is better than we've ever been before. And I talk to young folks all the time, and one of the concerns nationally, particularly since 2014, 2015, is the number of police-involved shootings involving African Americans who are unarmed. The police involved shooting numbers across the country, we had fewer police involved shootings in the last decade than we've had since the 1950s. And most people would be shocked to hear that because we see so much of it all the time. But police officers are better trained, not perfect. We haven't arrived yet. We're not planting the flag in the ground, but we're certainly well on our way. And, back when I first became a cop, guys like Joe, they may have existed and they may have done some of what Joe does in it informally, but it certainly wasn't a formal role. And the fact that police departments rather recognize the necessity to have the Joes of the world in a formal role to do his important work is a huge step.
Is there anything that either of you could speak to in terms of failures, things that maybe that aren't working well? That seems to be one of the things that the question seems to be interested in, is failures in model concept, or any lessons learned from failures there.
Well, I'll just finish up with this. So the zero tolerance days of policing that really late 90s, probably the better part of the first decade of this century, those zero tolerance models disproportionately saw arrest rates and incarceration rates of people who were mentally ill or drug addicted, who didn't need to be in a jail. They needed to be receiving some mental health treatment. So we've pivoted away from that. So that was certainly a failed model. And one of the things that I did in Baltimore, and I think we were the 5th police department in the country to do it, is we adopted a Seattle program called Law Enforcement Assisted Diversion, which took low-level drug offenders who otherwise would have been candidates for an on-scene arrest, and instead of slapping handcuffs on them and introducing them to central booking, they had an immediate opportunity to go into a treatment program right away. Now, like any good idea, that's very, very expensive and costly, but it's a new model that came out of a failed model of, put handcuffs on every problem you see out there on the street, incarcerate as many people as you can, and lower the numbers, quote unquote, and hope the problem goes away. And we've just seen that as a failed model.
And I have 15 years in law enforcement. So, and I've, for 10 and a half of those, I've been on mental health. Right. And so I will admit that my views are limited. I agree with that point of, addiction was always a behavior issue. It should have never been a crime issue. And I think, if you look at one of the things that we were recognized here for in Bexar County was we have a 5,000 bed capacity jail. We were being threatened by the state because we were overcrowded. They were going to sanction the jail. And the immediate impulsive response was, okay, we just need to build another jail. Let's build like an annex. And somebody smart came in, Gilbert Gonzalez, who's actually the director of behavioral health for Bexar County, said, well, what if we actually took a look at who's in the jails? And what we found out is it was a lot of low level offenders, just petty misdemeanors that were mentally ill. And what we know is that someone with a mental illness is going to stay in jail longer than someone who does not, most times, because they don't have the social capital or the social network to get them out of jail as someone who's connected and a high level offender. And so those are the ones occupying the jail. And so now we hover around 1,000 empty beds, 10 years later from when this was first happening. And, we're at 4,000, between 4,000 and 4,500, just depending if they do a warrant roundup. But that made a huge difference. We didn't build another jail. We build resources. We build a mental health center. And so I think as far as nationally goes, consider who's in your jails. Why are people in there? So I know it's one of those slippery slopes, because right now the pandemic has led to people being let out of jail for health reasons. But I think that there's definitely an opportunity to expand that beyond, okay, if it's not a health reason, but why are you in here? If someone could receive better treatment, which often is cheaper to receive in the community than it is to receive in a jail, then it makes more sense to actually give them a community-based treatment solution rather than an incarcerated treatment solution. And then the other thing is, also to piggyback on what the commissioner was saying earlier about training, I think that in 2020, there's no excuse why a police officer in this country should not have some level of crisis intervention training. I have seen many different, a very wide spectrum of what CIT training looks like in this country. Some people do it really, really well. Some people, it's just checking the box. I've seen it from a you know, and it doesn't matter who or where, but on the county side of an elected official through a sheriff, using it as a political toy to say, hey, look, you know, we're doing mental health training, but with no follow-up, no follow-through, no refresher training. And so I think it's easy to tell if the priorities are in the right place for the right reason. But there's this big debate out here about should CIT training be mandatory or not. And sadly, international CIT believes, because they're tied into this Memphis model. And I love Sam Cochran and all the Memphis models, been around since 1987, but we have always disagreed. And just, this is Joe Smarro's opinion. It's not the opinion of the police department. But we have always felt that as a police officer in this country, we do not have the luxury to pick and choose what calls we go to. So we should not have the luxury of picking and choosing the training that we have. And to the commissioner's point, it shouldn't be an elective. Yes, anything beyond that. So, and here's why it's important. We have a dedicated mental health unit. We have since 2008. You know, Chief McManus saw it as a priority. He was one of the first major city police chiefs to mandate 100% of his 2,300 member department was going to go through 40 hours of CIT. And he received the Sam Cochran Award for that, which is interesting because now, and through the film, you know, we've had a hard time getting CIT International on board to support the film because they don't like that we train cadets in CIT in 40 hours. And they don't like that we mandate everyone go through CIT training. Here's what I would say. It's been phenomenal, the response that we have had with officers forcing. Anytime you mandate anything on an officer, you're going to get pushback. But the ones that showed up the most outspoken on Monday, like, nope, I don't want to do this. I don't believe in this crap. This isn't what I wanted to become a police officer for. I'm not a social worker, yada, yada, yada. By Friday, they were eating out of our fingers, just loving this and saying like, hey, I want to be more involved. I wish I had this 20 years ago. I wish I knew this earlier on. Oh, by the way, my wife is diagnosed with this, or I have a son diagnosed with this, and I'm frustrated by the system. And now I see it differently. It's been phenomenal. And we would have missed all of those officers if we made it voluntary, because CIT isn't sexy. Cops aren't going to volunteer to sign up for it. A lot will, but not everybody will, because again, that's not what the recruiting poster got them hooked in to do. You know, it was, I want to do the high speed stuff. I still enjoy the running and gunning, chasing people, kicking doors. But that's just not the reality of what a lot of officers are doing across this country. That's all sensationalized, you know, media propaganda, live PD type stuff that gets people into this profession for the wrong reasons. And I've always felt that way.
Great, thank you.
Dr. V, if I can
yeah.
I add to that for just briefly? Because of the progress that police departments have made with the mobile crisis teams and CIT training, our profession's use of force training has changed as well. And it's all related. The knee bone's connected to the leg bone. So the Police Executive Research Forum, led by their executive director, Chuck Wexler, has introduced, and we were the first big city police department to do it, but it's kind of gone viral across the country now, as a type of training called Integrated Communication Assessment and Tactics Training. And it is a totally different way. It's based on a little bit on a European model, but the difference over there versus here is the, you know, proliferation of firearms. But it allows officers and teaches officers to slow down. And it's okay to slow down. You don't have to rush in and put yourself in a position where you're forced to make a life or death decision that you otherwise could have taken a step back and made a better decision. So that type of use of force training is a byproduct of our profession's commitment. And it's not, like Joe said, it's not perfect, it's not across the board, but from the commitment to doing bigger and better things with crisis intervention, our use of force has changed as well. And it's really paid off in so many ways.
Great, thank you. Here's a question here from Joe Padilla, and I could pose it to either of you. In regards to the police force in this time, is this creating an extra layer of vigilance adrenaline, much like a soldier on the front lines? If so, do you suspect in the coming months there will be a more than normal increase of mental health care needs amongst the force? And what are the specifics in place for the internal education and trainings for now and for preparing for the future?
I think there needs to be an increase in mental health care needs among first responders anyway, because again, the suicide numbers continue to rise every year, and bluehelp.org does a great job in tracking those. And I know that while that's a voluntary mission, I think they were just backed by the BJA to actually help them collect more accurate data, because we know that those numbers are very conservative. I would say, and again, I know this answer is going to be very geographic specific, but we've been fortunate here in San Antonio. This isn't like a zombie apocalypse. No one's out there fighting and acting out of their minds because of COVID. In fact, population is really, really down everywhere because so much business is closed, because the malls are closed, because the highway traffic is just non-existent. People aren't out and about unless they have to be, for the most part. And so we're just not interacting with people. And so I wouldn't say that their vigilance is up. A lot of officers, just based on, again, what they're being told to do, we're getting out of our roll call briefings and we're just going to some empty parking lot somewhere. So we're visibly open to the public, and we're handling calls from the phone when possible. If there's a crime in action, an assault in progress, or something with violence, yes, we are responding to those, obviously. But I wouldn't say that I've noticed or heard about any increase in vigilance to a soldier on the front line in an enemy territory. It's still America. We're still relatively very safe here. And so at least here, I haven't heard that being an issue. But I would say that the mental health needs are absolutely a concern. Because I think more than the vigilance is just the uncertainty. I think that's more pressing for each officer, is not knowing day to day of what's going to happen. Am I going to be infected? Am I going to have to do something on a call today where I'm not going to have a choice, and then I'm sick and my family's sick? And, we have procedures in place. We have hotels that have donated floors for officers that if they get infected. So we have things ready, but I haven't noticed an increased need for vigilance.
Another question here is to what extent do you believe police and social workers should collaborate, share notes, or provide referrals to each other? And what are the major barriers to this collaboration, and how might they be overcome?
Well, I'll take a shot at that, Dr. V. I think the relationship between police officers, police departments, and folks in the social work community is greater now than it ever has been in the past. And as a young police officer, I used to hate when someone would tell me that you're just a social worker, because that had a negative connotation to it back in the 90s. But like Joe said, I've certainly experienced all the cool stuff that our profession has to offer. I was in SWAT, I was in narcotics, and I had opportunities to do those things that you tend to see on recruiting videos. But even when I was doing those things, and Joe said 95%, I'll up them 1%, 96% of the time police officers spend is not doing those things that you see on the television shows and the movies. Certainly not as often. Right? Do we do those things? Absolutely. Police officers are heroes. They put themselves in the line of danger all the time. It's a dangerous profession, no doubt about that, not taken away from that. But police officers who embrace the aspects of their job to interact with people who aren't under arrest, who aren't victims of a crime, who aren't suspects in a crime. We interact with people. That's what we do. And the reputations of our police departments rise and fall based on the quality of our interactions with the folks that we serve. And it goes, across the profession. So if I'm answering that correctly, that's kind of where I see where we are with that.
Yeah, and I'll jump in. So, it's super important. And again, from the mental health standpoint, we actually have 3 social workers, clinicians that are on our unit that are civilians, and they're full-time attached to us. Now, they're not employees of the city, they're employees of the local mental health authority, but they do work with us. Now, there is this thing out there called the co-responder model, which Commissioner Davis was talking about, where you have a clinician in a car with a police officer. Obviously, those are well-working relationships. We don't do that here in San Antonio, and I know Houston does that. There's other cities that do it. We have kind of pushed against it. The idea is, while we know it's important to work closely with them, I want them to show up on a call, preferably in their own car. But I would, if you give me a choice of having another police officer in the car with me or a clinician in the car with me, I'm going to choose a police officer, and here's why. In my 10 and a half years on this unit, I don't have one use of force. And I fully attribute that to the fact that I've always had an officer there with me that allows me. It's not to say, because there is this, misnomer out there that, or this failed idea that, that the mental health unit has poor tactics because we dress in plain clothes, we drive unmarked cars, our guns concealed inside of our pants, but we have had very, very few use of forces on our unit. And the reason for that, one, is we're out of uniform, which immediately de-escalates the situation. But two is I have a secondary officer there that's watching everything from a tactics standpoint. My entire goal, and I've said this for a long time, I need to trademark it, but my goal has always been connection, not correction. I'm not there to fix your problem. I'm not there to solve any issue. I'm truly there to connect with you as a human being. That is where when I get to the heart of a person, regardless if they're high, if they're sick, if they're addicted, if they're angry, if they've just done some heinous thing. But if my goal is on connecting with them, not correcting something, then I'm going to be able to connect with them. And it's worked 100% of the time. And I know part of that is luck. I know that it's only a matter of time, maybe, if I keep, but this is well over 1,000 interactions with people, with firearms, with knives, jumpers. And I can say that the reason I don't have a use of force is because I have an officer there as my secondary watching tactics, while it allows me to relax enough in my mind that I don't have to think and worry about, what are they going to do next? I've already prepared going into the call. If you just have a social worker there, now I have to worry from a tactics mindset of, is my social worker safe? Is my clinician in the right distance? Where am I going to position myself? It changes the dynamic so much when it's a 1v2 versus a 2v1. And so while I think it's super important to have clinicians very, very closely tied into your law enforcement groups, I think you have to be careful on how you do it. And then specifically to barriers. HIPAA and people's confusion about what HIPAA even means. So people should understand that HIPAA is not a law about not sharing information. HIPAA is a law that supports the idea of sharing information responsibly. Law enforcement officers are not HIPAA reporters. So if it's in the continuity of care or a public safety matter, we are privy to information that is otherwise protected under HIPAA. But there are certain agencies and cities and other places that see that as a barrier because they don't understand the laws well enough to know that, like, no, I am, as a police officer, privy to whatever information is in their medical jacket because my sole purpose is actually helping them out or keeping the community safe. But there's a lot of confusion around that. And so that's the benefit of having a designated specialized unit, not just doing CIT training, because as a CIT trained officer, you might go from a barking dog call to a domestic violence call, to a shooting, to a chase, to eating lunch, to suicide in progress, to then a mental health call, to then, and it's like, they're all over the place. I know 100% of the calls that we're going to go to are mental health related calls, 100%. So it allows me to really think about things differently. Again, not be unsafe, but think about things differently. And we haven't had one officer on our unit physically injured or hurt. And we've had very, very few use of forces we now have 13 officers on the unit. And it's a testament to, again, the training and our ability to saturate this and do it full time.
But Joe, I'll just add to you, the success that you have ongoing and your team is greatly attributable to you as a person too. And, one of the things that our profession hasn't done well is how do we attract the kind of police applicant that we want to become a police officer, right? So we
change our recruiting videos.
Yeah, right. And I changed them in Baltimore, much to the chagrin of a few of the traditionalists. But when we're bringing an applicant in the door, are we examining that applicant differently now than we used to in the past? And I think sometimes those onboarding practices are slow to catch up with where the police department leadership is and vision is. So if we're testing your your hearing and your eyesight, and we're pulling your high school and college transcripts, and we're talking to your neighbors about you. I don't know that tests well your capacity for humanism, and I'm not too sure that there's a test out there that could test your capacity for humanism. But I think we need to do different things when it comes to looking at the capacity of a police applicant to embrace the parts of the job that they may be unaware of when they walk into the door. They're walking into the door no matter where they are, big city, county, rural. I'm going to get a police chase today. I'm going to jump on a helicopter tomorrow. All those things. And I think we sometimes don't do a good enough job letting people know what the profession is really, really all about. And your point about the mental health professional being separate from the police officer, that's a great point. One of the luxuries we had in Baltimore, because it's such a dense geography and population, is the police officers are so close to one another that mental health professional in the car wasn't a problem. And the reason why I liked it is because it was immediate access, referral access. And then lastly, and I'll turn it back to Dr. V, there is great confusion about HIPAA. So much so when we started tracking heroin overdoses in Maryland, we got a lot of pushback from our emergency rooms because they didn't want to share, not the name, not the date of birth, not the raw numbers. They didn't even want to share the raw numbers of people who came in to their emergency rooms on a heroin overdose. So we were missing, and still are missing, quite frankly, the real number of people who overdose on heroin or fentanyl or you name it. And it's not because of what HIPAA says, it's because of what people interpret HIPAA to say. So that's an ongoing educational effort.
Great, thank you. There's another question here, also from Dan Cornfield, which I think relates to this and to the point that Joe was making earlier on about the new policies all the time. So are police officers becoming jaded due to constant interactions with frustrating bureaucracy and difficult situations and so on? And is this interfering with their ability to have the emotional presence and creativity required for effective crisis response? How could such jadedness be addressed?
Yeah, so my short answer is yes, I do see that. Again, one of the other side of that same coin of getting to do that in service each week, and I know this is here, but even beyond this, because I've made a lot of connections and I've traveled a lot with the film and talked to a lot of different agencies, and it's similar in a lot of places. There seems to be such a gap between police leadership, especially in big departments. Now it's different. Like Commissioner mentioned, most departments are under 50. I think that last I saw, the average police department size in this nation is 10. When it boils down to, that's the average. And so smaller agencies is very different because it's more familial. Everyone knows everyone well. But when you get into a large agency or a mega agency, even ours, 2,300, but you look at, Philly and Detroit and Chicago and LA and New York, there's such a gap oftentimes between police leadership and your patrol officers out there doing the job. And it seems to be such a point of contention of they don't get this from the patrol officer standpoint, right? Of, these new policies are being created and we don't understand oftentimes why that stuff is happening. From a police leadership level, there's a lot of pressure about meeting expectations, external expectations of city council, city government, state, different places, different things, people putting pressure on why is this happening? It's all data-based, it's all trend-based. And I've heard people in high levels of law enforcement leadership say, I know for a fact that I am so disconnected from the actual job. A lot of the decisions I make are in a boardroom based on paper, based on data, and I'm not actually in tune with what's going on. My problem with that, and again, the commissioner, I guarantee, will have an answer for this, but the problem I have with that is like, what is stopping you, regardless of what your rank is, if you're a chief, deputy chief, assistant chief, like what is stopping you from going around and making the rounds and showing up to your lowest level employees and saying like, hey, what do you guys need? What do you girls need? What are you seeing out here? And how can I make you feel addressed? I know for a fact there are a lot of departments who will go more than 1 year and never see their police chief or their sheriff. never see their assistant chief, not one time. That's a problem, right? And so when you have decisions being made at a high level, how is it affecting? And I think that can play into this jadedness because there's confusion. The other thing, and I think this ties into the last thing we were talking about, and I'll really summarize it because I can go off on a rail on this one, but how do we recruit more, I guess, better suited people, the human type people to do this profession? I think that's only one leg of it. I think what's more important is we have to be honest, just like we looked in the jails. I think, and I know this rubs people uncomfortably, but we have to be honest to look at how we train police officers in this country. Police academies, there's all kinds of data on this, but how many hours are spent on shooting your firearm? Average was 60 hours, and the average, national average of de-escalation training in a police academy is 8 hours. So right there, you're putting so much emphasis on the thing that most officers will go through their entire career never using. And 100% of officers, the first day they graduate, are going to need to know communication skills, de-escalation skills, and how to connect with people. And if we looked at reshaping, really, I'm talking about a complete overhaul. It is so important that, yes, we prepare officers mentally, right? I'm a firm believer in stoicism and all that it brings. And so this premeditatio malorum is prepare for the worst, mentally map out what could happen if. And I think in law enforcement, especially, every single call, hey, if this thing happens, I'm going to do this. If this happens, I'm going to do this. Mentally map everything, but not to the point where it prevents you from actually connecting with the person that you're actually there dealing with. And our police academies spend so much time showing videos of officers being ambushed and killed, showing videos of officers, being hurt or injured, forcing you to do physical force training where they're trying to pull your gun out of your holster to shoot you with it, and say, oh, you died today. Go tell your wife that you died. Like all these things that, like, why is that the emphasis of the training when we could spend days or weeks talking about human behavior, the neuroscience of why people do what they do? What is it that makes people, like every human being craves the same thing? Why do they not know that? And so I think we could really change, and I know, again, not popular, we could change our police academies to be more academic focused with a nuance of tactics and the what if could happen. But if we had more of a focus on the true human science of the neuroscience of human behavior and why people do the things they do, that could be the way that we could actually start to shift this and shape it.
Joe, I'll just add on to that great response. Policing is a culture in and of itself. But there are subcultures within policing, and one of the subcultures is the training environment. Yep. And it's often very conservative in nature. I know when I graduated from the police academy many years ago, I was quasi paranoid, right? Because I had just gone through 6.5 months of the what ifs, and the what ifs are based on reality. In the history of the Baltimore Police Department, for example, been around since 1784. There have been 136 police officers killed in the line of duty. So that's an absolute reality. But that has to be balanced. And I think our police academies do a better job than ever before, but there's often an imbalance because we want to get through the mandatory training requirements that the state mandates. So I know folks who have commanded training units, and every year it's all, we have to do one more thing and one more thing. And sometimes that impacts the psyche of the recently graduated police officers. And get back to your earlier comment about what prevents leadership from getting out on the road and interacting with their cops. The answer is nothing prevents them at all. And, I was always, a little scared of the fact that there may be some police officers on my department who have only seen me on television, who have only seen me on the news. Yep. And that doesn't bode well if I make a policy change. So if I interact with a police officer in a big police department like yours or Baltimore or my alma mater, Prince George's County, if I have had one human interaction with you, one handshake, one roadside conversation, one slap on the back, you're more likely to receive any policy changes that I make because you've interacted with me and you're going to give me that benefit of the doubt. And you're like, I met Joe and he's actually a good guy. So there must be a good reason why he's making this change. So I think that can't be said enough. And there is a zone of distortion that is too wide between leadership and the rank and file. And there's always going to be a certain zone of distortion. And the challenge for police leadership is to shrink the zone of distortion, have it be this big as opposed to this big. And then finally, the jaded, cynical, sarcastic police officer. I think at some points in our careers, we've all been jaded or cynical and have used sarcasm to cope with the things that we see on a daily basis. That is absolutely not normal. It is not normal to be exposed to this level of crisis. So we cope with that, in unhealthy ways. Alcohol abuse, drug abuse, disproportionate domestic violence, suicide. But another way we cope with it is by developing this us versus them mentality. And it's the cops versus the world. And if you're not careful, by year 5 to 7, like that's like the witching hour for me, for police officers. If you get in that year 5 to 7, it's like you're a sophomore, you're a wise fool. You know enough about the job to know what the job's all about, but you certainly don't know everything about the job. So yeah, it's police officers are police officers. I've been with 3 different police departments. They're all the same, and they're all great people, but they're all subject to being jaded too early. And it's because, again, we see things that aren't normal. We interact constantly with people in crisis. We diffuse situations multiple times a day, and it has an impact on us. And the health and wellness units and people like you who do this important work can't eliminate it, but certainly can mitigate it.
Right, thank you so much. Can we have one last question, maybe in a minute each, if you could address how you think policing and mental health crisis response will look like 20 years from now, and then what perhaps should it look like, do you think there would be, if there would be a discrepancy?
I'll go and then we'll let Commissioner wrap up. I think, he's kind of touched on it in the fact, I do agree. We are doing a far better job today than we ever have. And I've only been doing this 15 years. But even in that time, I mean, when I went through the academy in 2005, we didn't have any mental health training. There's so many departments and agencies, sadly, that are stuck in this traditional type of way. And one of the things I think, when you look at a lot of police chiefs and sheriffs, they're there because of time, right? They have 2 decades, 3 decades of time, and they've worked their way up. They've earned that spot, that title. But a lot of their beliefs and ideologies are based on what things were when they were young cops. And so much has changed. Society has evolved around them. And that's where the disconnect happens, is when police leaders are trying to build policies based on what things used to be instead of what things are. 20 years from now, I actually have a lot of hope. I think that there is incredible promise. I do believe that a lot of this idea that the community doesn't support us isn't actually true. I think that we have far more support for our profession than realized, and I think that's internally and external. So I imagine 2 decades from now, it's going to look incredibly different. I do hope that the police academies are entirely changed. I hope that the emphasis is placed on actual community saturation and involvement instead of, and how do we address that, us versus them, because I think it's a real thing. And there's been a lot of work done around this, and the whole sheepdog mentality and all this. I think the thin blue line needs to have like gaps in it, right? Which, like with 2 arrows, because we're allowed to leave it and the community is allowed to come in. It shouldn't be a border. It should be a 2-way thing. And so my hope is that 20 years from now, what this profession looks like is we have double the amount of support that we have right now. Officers are not jaded at 5 to 7 years. And I think, what's fascinating, and this is real numbers, is, in the last 10 years, and just for this department here in San Antonio, it was unheard of to leave short of even 30 years. Most people that got into this job doing the academy 7.5 months, they stayed 30 years, got the great pension, and really loved getting to that point. We are having officers leave left and right with less than 5 years on. And, people will be quick to say, it's a millennial issue. And I disagree with that. I think that, again, there's a confusion. That I love that zone of distortion. It's people not fully understanding what they're actually getting into, for one, so they're not being properly prepared for this. I love the fact that you said it, Commissioner. I've said this many times, but it's like in many academies, there's a 55-gallon drum of paranoia. They draft this massive syringe and they inject you right as you graduate and say, good luck out there. And people are graduating afraid, and they're waiting for that adrenaline hit to hit, that pump to hit. And so I hope all of that is really looked at. Perf does a great job of looking at all these things and thinking about how we can address and handle certain challenges. And so I'm hopeful that with organizations like Perf and with organizations like NAMI and with organizations like CIT, they will continue to work together to collaborate to make our role as first responders much more seamless and not as difficult. Also, I want suicides eradicated completely, because one is too many. I would love to see an entire year before I die where not one first responder kills themselves. Thank you.
Yeah, well, it's tough to follow that answer, Joe. Great job. It was probably 2/3 through my career that I finally got comfortable sitting in a restaurant with my back to the door, right? Because that's drummed into you as well. And occasionally I'll go out to dinner with someone and I'll sit with my back to the door, and they'll say, do you want to sit here? I know all you cops like to face the door. And my answer nowadays at this stage of my life is, it's okay. I'm going to get under the table like anybody else. So, but that's a cultural thing. So, 20 years from now, Dr. V, if that's the question, more people like Joe will be a police chief. Joe, you got that police chief look. You might have to shave your beard though. But you've got, so more people like you will be in leadership positions. And so I hope that's on your bucket list to keep climbing the ladder. And we need people like you leading this profession. We are more enlightened leadership now than we ever have been, but I think back to the leadership that existed when I was a rookie cop in 1992. Very traditional, very, Vietnam veterans, and not to take anything away from their service and their sacrifice, but it was just a different era in policing, and it's changed along the way. So I agree. We'll know we've kind of arrived when the police suicides are non-existent, because that's indicative of a healthy internal environment. I agree also that most communities, even in the toughest communities, need the police. They don't hate the police. I tell people that in Baltimore all the time. That I go to communities in East and West Baltimore, they love to see the police because they need the police and we need each other. And then finally, I think one way we'll realize that we're in a better place is if we attract non-traditional police candidates. So, some of Dr. V's students at the Catholic University of America who are sociology majors are now considering policing as a profession because it's another way for them to serve. And I think that's how we'll know we're going to make that type of progress that's necessary.
Fantastic. Thank you both so much for your time. I've learned a lot, and I'm sure all our attendees have as well. Thank you all for joining us. I don't know if there's a good way to give you a round of applause, but it's virtual. You can get on our end. But thanks so much again for joining us. This was fantastic.
Thank you.
All right. Take care, everyone.